The Achievable Clinic is a vibrant new path to healthcare. This is a place that's going to be an exceptional place to come and get cared for. In the state of California, currently there are about 250,000 people who have developmental disabilities. So autism, intellectual disability, Down syndrome, epilepsy, cerebral palsy. We recognize there was a profound need. There was an outpouring, a groundswell amongst parents and advocates for this population to provide some kind of quality access to health care. For many of those hundreds of thousands of people in the state of California, they have virtually no access whatsoever, and those that do, it's none of the highest quality. From that, we chose to focus our mission on access to health care. And once we got clear about that, the grants from foundations, corporations, and other community groups started to come in because everyone recognized this is important.
Do you want to give me a high five, Jay?
The other model for this clinic is a medical home model where there's communication across environments between families, the physicians, specialists, other medical care they may be getting, as well as some of the social service agency, and so that everybody's on the same page and communicating about the unique needs and challenges and appropriate follow-up in healthcare.
One of the things that to me is most exciting about the Achievable Clinic is that we're basically inventing a model of care and a home specifically for kids and adults with developmental disability and their families that should be comprehensive, that should attend to their specialty as well as their primary care needs, and that will be available regardless of people's ability to pay, regardless of their insurance status. There's this huge hole in the safety net that we see people falling through, and we aim to mend.
We know that children with developmental disabilities such as autism often have issues with sleep, with feeding, and with their behavior. And we want to include those in all of our visits. We want to include what's going on with the family and their reactions and abilities to cope with and manage what's going on with their children.
My name is Felicia, and this is my daughter, Faith. Faith had some complications at birth. My daughter didn't breathe for 11 minutes. 4 minutes is considered brain dead, and she's anything but that. The Achievable Clinic means everything does because it is more of a one-stop with people that specialize in helping a population that has developmental disabilities. And a lot of just regular medical practitioners and physicians really don't quite know what to do. And I get to come here with people that actually get my daughter, get her diagnosis, can foresee. Okay, we'll do that. But people that get her diagnosis and that can look into the future and that have followed patients from much younger than Faith to much older than Faith. I know that her needs will be met here. Here, everyone gets it, and I'm just comfortable and I'm grateful to be a part of it.
My name is Lynn, and I have an intellectual disability. I was born with that. Going through a regular doctor when you're developmentally disabled, they don't always explain things in depth to you, but because they work with people that are developmentally disabled or intellectually challenged, they explain it in a way that you can understand.
One of the bigger goals of the Achievable Clinic is to help the families, not just with the medical side of things, which obviously is what I can do and what a lot of physicians can do, but to help the families advocate with the school, advocate in obtaining appropriate resources, and ultimately to help them know that they're not alone.
As parents, we want to make sure that our children, we have 2 boys, their needs are being met. One of our sons does have Down syndrome. And it's been hard for us to find a place that would accommodate both boys, but also be able to accommodate the fact that special needs requires special attention.
We like the idea that we can come to a place where all of our needs are going to be met. We have a child with special needs and we have a child that's developing typically, and then we also can come as a family and and they'll take care of all of our needs. That's something that you can't find right now. and this is the perfect place.
And the fact that the doctor speaks Spanish, that's an added plus.
The ideal clinic to come to.
Pues, ¿cómo está Adrián hoy?
Oh, él está ahorita muy bien, está recibiendo unos tipos de servicios en la casa y cerca de su comportamiento.
One of the great things is our electronic medical records, and it's a good way of making sure that there's no gaps in services, that patients aren't misdirected as far as the specialists that they need to be referred to. We thrive on making it more personable and welcoming and comfortable for the families, individuals that walk through the door.
In order to be a clinic that provides really high quality care, it's going to be critical to continue to have the amazing community support that we've had. With that kind of support and financial support as well, I think this clinic is really going to fly.
This is planting that first seed, and we're here to watch it grow and shepherd it along.